Hi, Dr. David Kisling here at Fort Collins Eye Doctors in northern Colorado, and I just want to welcome you to our practice and tell you a little about one of our special services. We have developed the Dry Eye Center for northern Colorado as a specialty niche in our office to help people who suffer from dry eyes. Millions of people do suffer from dry eyes. The estimates range from 3 to 30% of the population may. Regardless of what that percentage is, we know that millions of people suffer from dry eye syndrome today. From very mild dry eye syndrome, which I may see signs of it beginning, and you as a patient may not be aware of it, to extremely severe, debilitating, completely interrupting lifestyle and ability to work and function, a degree that is completely compromising to an individual's life. The symptoms that I see patients experiencing when they have dry eyes fall into a number of categories. Burning is one of the primary ones. Oftentimes, an individual will have to pull off the side of the road when they're driving because the heat blows up on their eyes and dries them out just over the edge, creating extreme discomfort and stinging and burning. Actually enough to even cause a car accident in some individuals. Gritty, dry discomfort often accompanies dry eyes, and redness does. Also, it increases the incidence of eye allergies because there's not as much fluid to dilute the allergens in your eye. So you have a combination of problems that go together. There is also excessive tearing, which patients are always so surprised when we tell them that they have dry eye syndrome and they're complaining about their eyes watering all the time. Well, when you understand there's two mechanisms of tears, one is the normal mechanism and the other is reflexive, like when you chop an onion. And the dry eye is like that onion. It gets dried out, irritated, and then reflexively starts tearing throughout the day. So eyes that are frequently tearing is often a major symptom of dry eyes. And one of the other significant symptoms I hear is vision that fluctuates and clears up after people blink. The tear film is of such poor quality that it doesn't maintain a steady, good optical quality across the front of the eye. Now that tear film has several components. It has the watery layer, which is constantly being secreted by gland up above the eye. It has a mucus layer, which is secreted by cells on the surface of the eye, and it has a lipid or an oily layer, which is secreted by little glands along the margins of the eyelids. We can differentiate those layers to some degree, which one is at fault, and use different modalities to try and focus in on that, but frequently we're trying to improve all three. So how do we do that? We work with you as a patient. First and foremost, I need to know what kind of treatments that you're interested in. Because if you're not going to follow through with treatment, we need to discard that one and use some of the other options available to us. We frequently use several different prescription eye drop medications. We also use nutritional supplements. We also use eye drops of certain types that affect certain components of the tear film. And occasionally we'll use plugs that block the drainage of the tears through the tear ducts. We usually don't start with that anymore because the success rate is very poor if you initially start by occluding the tear ducts. And that's because dry eyes are primarily an inflammatory process. And until we cool down that inflammation, we don't want to block the tears and keep inflammatory chemicals in your tear film. I always feel like we can improve your dry eye condition, and usually significantly. There's no reason to suffer from dry eyes. We know factors that contribute to it. We know that age is one of the primary factors. When women reach menopausal age or postmenopausal, there's a significant increase in dry eyes. Environmental factors, low humidity climates, forced air ducts, extensive time working on computers decreases your blink rate and attributes to more drying out of that tear film. LASIK surgery or eye corrective surgery severs the nerves that cause you to blink. Typically they regenerate in 6 months or so, but in some cases they don't, and there are patients that are left with extremely dry eyes after LASIK. Most of these conditions we can treat. We can find interventions that can help with your dry eyes. So don't continue to suffer with the symptoms of dry eyes. Call us. We'll be glad to talk to you at any time about your condition. Our number is 970-226-0959. Our web address is drkisling.com, drkisling.com. Contact us in any way you're comfortable with, and we can provide you with more information. But mostly I'd encourage you to call for an analysis, to get started, take that first step towards improving the quality of your life. And we know that untreated dry eye syndrome worsens over time. We don't want to get to that point. We want to stop it, intervene, and try and restore the eye back to its normal condition before it's too late to do that. So take action now and get your dry eye treated. It can lead to an amazing improvement in the quality of your life. So we hope to see you soon. Fort Collins Eye Doctors, Dr. Kisling in Fort Collins, serving Northern Colorado, at the Dry Eye Center of Northern Colorado in our office. And we will address your dry eye problems. Hope to see you soon. This is Dr. Kisling at the Harmony Eye Care Optometry Clinic. Thanks and good night.